Okay, Michael.
Ready? I'm Michael Corley. I'm the Initiative Manager for the Debilitating Diseases Dementia Initiative. And the reason this initiative was chosen is Dorothy Patterson had dementia in her later years. And in an effort to honor her legacy, we're looking at what can we do along the dementia continuum of care. And let me take a step back first. If you look at the demographics, both locally here in Sarasota and across the country, the diagnosis of dementia is going to be a tidal wave of diagnoses over the next 10, 15, 20 years. Yet, very few people are talking about it. And so what we're looking at is how do we impact change for that impending tidal wave of diagnoses because of the aging population. Initially, we started looking at it from a medical model perspective and really trying to assess what is happening today. What is the current situation and the current state we're in? And what we looked at was that continuum of care of dementia from the time somebody's assessed to diagnosed to treatment to eventually till they're deceased. And what we've learned through the process is it's very fragmented. Our healthcare system is very fragmented, meaning people can go get very specific information and impact by going to a clinician, for example. However, that clinician may not know how to educate a caregiver in dealing with a person who has dementia and will continue to progress in that direction. So we've spent the last few months looking at the current situation and trying to really assess both locally and nationwide what is happening. And what we've learned is it's very consistent among cities throughout the country, that there is a stigma associated with dementia, there's a lack of understanding, and there's really a lack of effort to do anything about it. Not because people don't want to, but because there's a lack of awareness and because of the way our medical system is structured, and I'll touch on that in a minute. What we're also looking at now as we go through this and we're speaking to the experts all over the country is what is a desired state? What should it look like 10, 15 years down the road so that we are managing that entire continuum of care, and I keep referencing that entire continuum of care from assessment, diagnosis, all the way through eventual death. Because during that time frame could be 15, 20 years of experience that the individual and the caregiver has. So what are the best practices, what is the technology, and what can we employ to make a radical change for the betterment of the management of dementia? We're still in that phase. What's been fascinating is everybody we speak with has a different idea and a different perspective, but we're all held back on how things are currently done today. One avenue we've learned or one challenge we've learned is that the healthcare system today is very good at dealing with acute and short-term issues. Chronic issues are not addressed from a financial perspective or even a clinical perspective in the manner that we need it to be done. So one of the things we're looking at is how can we change that? How do we address that? And that's what a lot of the education we're doing right now is how do we overcome the stigma? How do we create awareness and education? How do we bring all these parts together so that we can make a difference? I go back to, we talked a little bit about the fragmentation of the healthcare system as a result of this. We've got some phenomenally well-intentioned people, both locally and really all across the country, that want to do the right thing and are limited by the box they're in. And if we can somehow, and we will, determine how to create the connective tissue among these, there will come a day when an individual is diagnosed with dementia and the family member says, what do I do, where do I go to, and they'll know exactly what to do. We're not there yet, but a little bit of effort in combining the best practice and the best minds across the country, I'm very positive that we'll be able to do that. So what are we doing now? Or we continue the exploration. It's been very disciplined to not try to solve the problem right away. We continue to talk to people, and each time we talk to somebody, we get a new nugget, a new avenue, and we'll continue to move down that road.